Welcome to Doctors Inn. I'm gonna be your hostess for today, Lulia Hubbi. Today we have with us Dr. Prem Kumar Sinha. He's the head of Department of Neurology at International Modern Hospital. Today he's sharing with us a message to the mass about the stroke. Dr. Sinha, could you please tell us what is stroke and what causes it?
A stroke is a major problem now in the world over. The aging population of the world. It's a common sight for you to see people getting paralyzed hand, leg paralyzed, dragging with a half-body paralysis. Commonly, a layman knows hemiplegia or a paralysis. Now, this is a stroke. When we say word stroke, means there is a block of the blood supply of the brain.
Okay.
If it gets blocked, the area of the brain supplying that part of the body stops functioning. And this is called stroke. There are two major kinds of stroke, basically, we subdivide. One is because the blood supply in the brain got disrupted because the blood vessel got ruptured. There is a bleeding in the brain. Grossly, people know brain hemorrhage. This is a more serious kind of stroke because almost 70% people, 60-70% would not survive.
Yeah.
Rather, another 20% or so will survive with a lot of disability. The other stroke we call is a ischemic stroke. Means the blood supply of the brain got blocked because of a clot forms. The clot may form locally or it form in the main vessels supplying the brain, that is a carotid in the neck, or the clot has formed in the heart and traveled to the brain. In all this mechanism, what happens to a person, that suddenly a person is doing any work and suddenly he is not able to use his hands. He's not able to hold a cup of tea. He just can't write. He wants to call somebody and he can't speak. His speech is affected. Or his face sags to one side. Now, these are the features, common features of stroke. So, the World Health Organization and American Associations of Stroke, we are all trying to educate the masses about stroke today. Why should we tell masses about stroke? So that now we have a treatment. The treatment which can work in first 3 hours, if we use this treatment called Clot Busters therapy, the person can recover. But unfortunately, most of the people, they come very late because the stroke doesn't give rise to any pain, unlike the heart attack. When a person is having chest pain, he is forced to come to a doctor.
Exactly.
Here, when he is having paralysis of a hand or the leg, he generally feels, oh, this is sleeping. So somebody applies some local massage, some oil massage, and they keep delaying coming to a doctor. And that is precisely we want to give the message to masses. Come to the hospital, having a neurologist earliest, as fast as possible. Call an ambulance, reach there.
Of course.
Don't waste your time going to here and there to clinics.
Doctor, what causes the stroke?
It's like in an old building. You find corrosion of the pipeline takes place. Similarly, in the human body, as we age, the arteries' internal lining, they start getting deposits of cholesterol. We call it atherosclerosis. This atherosclerosis or deposit of cholesterol plaques in the internal lining are much more if a person is having high blood pressure, person is a diabetic, or his cholesterol level is very high, or he is a person who is of a sedentary lifestyle. These are the people, or he is a smoker. He is leading a type A personality, very active life, very busy life, a stressful life. These are the factors which promotes internal lining of the blood vessels getting more cholesterol deposit. The whole body is same, whether it is a coronary heart attack or the brain attack. A stroke is also called brain attack. The artery internal lining where the cholesterol is there, that breaks up. The cholesterol deposit comes out. This leads to clotting of your blood at a local site. If the blood clots there, the blood flow beyond that point stops. Now, if it stops, the brain has got very short life. If we restore this blood supply within 3 hours, that part of the brain will come back. If we delay it more than that, there is an irreversible damage.
Okay.
Means it will not come back. Functionally, it will not come back. So, whole stress lies today is preventing these 4 factors. They are preventable. A lot of emphasis on the smoking prevention world over, WHO's effort. It is more poisonous than narcotics.
Yeah.
We're talking about blood pressure. People are sensitized. Check your BP, keep your BP 120/80. Higher than this, the more higher it is, the worse it is for your artery. Unfortunately, even those people who are having high blood pressure, they are not regularly taking medicine. Do you know, only 40 to 50% people, even in the best of the countries like America and Europe, they are getting BP fully controlled. Others are not compliant because it doesn't bother them. It doesn't cause any pain. So they just conveniently forget taking the medicine.
They just ignore it. Yeah.
Similarly, the diabetes. The large majority of the diabetic, they don't have any symptom. And since they don't have symptom, they can silently going around in the society being as normal, but they are diabetic. Their high sugar level is damaging. Therefore, effort to check, they screen the whole population for diabetes, particularly in Middle East area. The diabetic rate is one of the highest in the world, roughly about 19.5%. Imagine.
Yeah, it's a
This
big
is the
amount.
population of and because there is a plenty to eat and nothing to work. Don't exercise. Everywhere you move in the car. So the obesity is a major problem and diabetes is a major problem. And genetically, we are predisposed group.
Yeah, of course.
Indians are more at a risk than a European or a white man. Now with this and the smoking, we're seeing how prevalent it is there. So if we tackle these preventive factors, treat diabetes, hypertension, have an active lifestyle that everybody exercises at least 30 minutes a day or 20 minutes of walk a day, 5 days a week, good enough.
Yeah,
You reduce your risk of stroke and heart attack by 1/3. So this is the causes of stroke.
Doctor, you just mentioned the Clot Busters. What is it exactly? And is there any side effects of using this treatment?
Clot buster therapy is relatively a new therapy for about a decade old or so. Now, there is an agent called tissue plasminogen activator, TPA.
Yeah.
When this is given in an IV, within 3 hours of a stroke, as I told you, the brain doesn't have a long life. So how do we decide before giving it? I have to do a CT scan for a person to say there is no bleeding, otherwise we'll compound the problem.
Yeah.
So quick CT, if there is nothing, no bleeding is there inside, and the person is paralyzed half the body, then we start this therapy. It is given a small dose of bolus and the balance over a period of 1 hour. The person is monitored closely so that in case there is a small chance of a bleeding happening in the brain because of clot dissolving therapy itself,
Yeah.
which is roughly about 6% or so, 6 out of 100. But when we look at a whole group of treated and not treated, there is overall great benefit in people who have been treated promptly. So this risk we explain to the family. And we tell them that this is the treatment, only treatment available as on this date for this condition, which is going to be benefit to him.
Of course.
And this therapy is not available at many places because they don't have that kind of a protocol and infrastructure to process the patient so fast. Within 1 hour, you should have a CT scan and you should start the therapy.
Yeah.
From the door to needle time, 1 hour. So that's why we propagate this message to people to call an ambulance and come to a center, neurology center, which is providing you clot buster therapy or thrombolysis therapy, we call it.
doctor, how would a common man would know if he has a stroke?
Very important. Common man, see, to make it simple to understand a common man, American Stroke Association has given a word called FAST, and they are propagating it.
Yeah.
F stands for facial weakness, A of FAST stands for arm weakness,
Okay.
S stands for speech, and TL stands for call, telephone the ambulance. That means we want to tell the people in case suddenly they develop weakness of the face, left or right half the face, or their speech goes slurred, and they find arm is weak, they must consider it as evolving a stroke or an onset of a stroke.
Yeah.
And no sooner it happens, they should call the ambulance. Ambulance will take them to a center which is providing thrombolysis. Important to tell this point, don't go to a small clinics which will waste your time.
Exactly.
Don't start applying local rubs and aisles and massages to thinking it is one of those common numbness. This is stroke.
And please tell us, what is the minor stroke and TIA?
See, many people, they develop this weakness. Like in office, they will say, suddenly I had some weakness of hand, my pen fell, I couldn't use it. Then I rubbed my hand, in 5 minutes it became all right, and then I'm all right.
Yeah.
Should I go to doctor? I'm a diabetic, I'm a hypertensive, I smoke. Fine, I am 56-year-old man. But I feel I'm all right. It was just a stress. Now what exactly he suffered was a minor stroke. This we call it transient ischemic attack. Sudden onset of weakness on half the body, sudden onset of sensory symptom on half the body. This is a minor stroke which goes away.
Yeah.
It generally lasts from few minutes to few hours. But it has given a warning that the area where this weakness has happened, that area is under risk, is under threat. Now commonly it happens when some clot from the neck artery, that is a carotid, travels to the brain. Suppose this carotid clot, there is a plaque there in carotid, which has made a small clot, which traveled higher up in the brain, which produced weakness on the opposite side of the hand or the face.
Yeah.
Lasted few minutes, went away. Now this man did not come to doctor. Next time the another clot will go, it will permanently block it and he may develop complete paralysis with irreversible damage. And if he goes, and that risk is almost 1/3 of them will develop this problem over a period of a month. It's very high. In the first 8 days time, the risk is almost 10 to 12%.
Yeah.
Very high risk. 1 in 10 will develop a full stroke. So this person must go to a neurologist center for quick evaluation that how is his carotid. They will do carotid Doppler or a carotid angio. Whether the clot came from the heart, they will check the heart by echocardiography, whether there is a clot there. They will do a MR angio for the brain to look at how is the blood circulation of the brain going on.
Yeah.
And he should be put on antiplatelet agent, that is blood thinning agent. Important. And then he should be put on modifications for the cholesterol, that is the plaque has to be stabilized.
Yeah.
If these treatments are given, we substantially reduce the risk of a major stroke. Means a person who has a minor stroke must come to a doctor and get the treatment started, evaluation done, which will prevent a major catastrophe in a near future. So the message for all of them for TI is come to doctor immediately, just like any stroke.
Dr. Sinha, could you please tell us what is hemorrhagic stroke and how it can be managed other than the usual stroke?
Said hemorrhagic stroke. Hemorrhage means bleeding. Anything which comes suddenly, we call it a stroke.
Yeah.
In hemorrhagic stroke, there is a sudden bleeding in the brain. When the bleeding happens in the brain, what happens? Inside, the brain is closed in a skull. The pressure rises. Brain doesn't get enough other blood supply. So the person may become unconscious.
Yeah.
So, the brain hemorrhage is present with sudden onset severe headache, vomiting, and paralysis of the half the body, or depending on where it is bleeding.
Yeah.
If it is bleeding in the brain stem, that is central part of the brain, he may have paralysis of both the limbs and could be unconscious. If the bleeding is happening between the covering of the brain, under the covering, then we call subarachnoid bleed.
Yeah.
Subarachnoid bleed, the person may have severe headache, vomiting, and he may not have weakness of the limbs immediately. Anyway, important point for doctors or this people handling these cases are to find out whether there is a bleed at all in the brain, means urgent CT, and then where is the bleed?
Yeah.
Is it in the brain, in the bleeding in the brain, which is because of the high BP, which is the commonest culprit? Is it bleeding in the brain due to some abnormal blood vessels which were there in the brain right from childhood and which has bled now? Because in the brain there could be abnormal formation of the blood vessels. We call it arteriovenous malformation. They can bleed at some point of time. Or third thing could be the outpouching of the blood vessel. Like blood tubings are there, the outer wall bulges out and it can rupture suddenly. They are the commonest cause for subarachnoid bleed. Now, all these three entity treatments are different. If the artery wall is bulging and which has leaked, and that the patient is presented with headache, we call it subarachnoid hemorrhage. And this is treated by a surgery in which they open the brain and they clip the area, put a clip there so that it doesn't leak again.
Okay.
Or they put a catheter through the artery, go in the brain and put some coil over there so that it doesn't leak out again. Because leaking, repeat leaking is very, very high and which could be killing.
Yeah.
The person who is having a bleeding because of high BP, it is inside the brain, the blood bleeding has happened, then we try to bring down the BP very fast. BP could be very high at that time, so we give a IV medicines, intravenous medicines, to bring down the BP just around 150 by 90 or so, as fast as possible. By doing so, we reduce the size of hemorrhage, which is going to increase with time.
Yeah.
So this has benefit for the patient. Third group is that there is a big bleeding in the brain where the malformation is there. In such cases, it is putting a pressure on the whole brain inside. The skull is a closed cavity. So surgically open the brain and remove the clot so that the brain, rest of the other part of the brain is able to survive. They get a blood supply.
Yeah.
They survive. So surgery for them is required. So brain hemorrhages of hypertensive origin, they need a promptly bringing down the BP and managing the patient. People who have got arteriovenous malformation, making a big blood clot, they need a surgery urgently. The person who has got outpouching of an artery, we call it aneurysm. And mind it, 1% of population is having a brain aneurysm.
Yeah.
1 out of 100 of us. So it can blow up in anybody.
Common, yeah.
And now when we are doing so much MRI and CT, many times we are finding a person who has no symptom but he has aneurysm sitting. Yeah. It creates another kind of problem that he is asymptomatic and is sitting on a bomb.
Yeah.
Fine. So this is the brain hemorrhage. It's a very serious condition and they all need a prompt attention of a neurologist.
Could you please, doctor, tell our viewers what a person should do when he gets sudden onset severe headache?
You ask questions, sudden onset severe headache.
Yes.
Very, very precisely.
Thank you.
Headache is a very common presentation in the emergency department. It's a two different case. Here is a person who is getting headache every week, every month, and then today also has come with yet another headache. There the commonest cause is migraine. There we don't worry. But a person who never used to have any headache, for the first time, he gets headache bolt from the blue, we call it. Like suddenly sleeping, suddenly get a severe headache. Generally the person will become faint or he will fall down and will regain awareness and say, my God, I am having a severe bursting headache. And the doctor finds he is vomited. She has no memory how it started. She says, I was in the kitchen. When I opened my eyes, I was on the floor and I'm having severe headache. Terrible headache, doctor. Now, here is a person. We should look for an entity called subarachnoid bleed. Many times what happens, these cases are missed. They are taken as migraine or any other cause of headache and given some painkiller and sent home, only to found few hours later to be having a severe complication or becoming unconscious. So one should not miss subarachnoid bleed. That's for the doctors, ER. And this is because of the outpouching of the artery, which leaks and bleeds like this. So any bolt from the blue kind of a headache, sudden onset severe headache, we look for subarachnoid bleed. We do an urgent CT for this patient to rule out bleed. CT is very sensitive. Almost 90% of them will be picked up in the first few minutes or hours of the onset of this. So subarachnoid bleed is to be thought and not to be missed. And of course, if it is inside the brain, we will pick it up.
Doctor, as a conclusion, what's your final message to our viewers?
Important messages are: learn to recognize a stroke. Anything which suddenly happens to weakness of the face, weakness or difficulty in speaking, or weakness of the arm, assume it is a stroke and call an ambulance. Come to a center which has a neurologist which is providing clot buster therapy or thrombolysis therapy. Time is brain. In brain attack, act fast. Come to hospital, get treated. Don't delay. World over, millions of people could have benefited if they came to hospital in time. Even best of the areas of the world, only 10-15% people are able to reach the hospital within 3 hours window period. 3 hours window period is critical. If we reach a hospital within that time, we give you thrombolysis and we make you walk. Not sit in the wheelchair, but walk. That's a big gain. So recognize a stroke, take help from doctors, lead a healthy lifestyle, stop smoking, buy a sports shoes, start running, have a healthy diet, keep your weight healthy, check for glucose, check your BP, stay cheerful, think positive. That's the message.
Thank you, Dr. Prem Sinha, for being with us today and sharing all of this useful information. Thank you for watching us in Doctor's Inn.